Good morning. I'm here with Mayor Sylvester Turner. We also have social distancing off the shot for in case folks have any questions. Chief Acevedo, Chief Peña, the fire chief for the city of Houston, Chief Bunick from their Office of Emergency Management, Francisco Sanchez from the Harris County Office of Emergency Management, Dr. Peirce with the City of Houston Public Health Department, Dr. Shaw with Harris County's Public Health Department. I know Councilmember Cassius Tatum is here as well, and so those folks will be available to answer questions. I will speak, then Mayor Turner will, followed by Dr. Mark Boom, who is the CEO of Methodist Hospital, as well as a physician himself, and Dr. Porsa, who is the CEO of the Harris Health System, as well as a physician. First, let me thank everyone who is doing their part. I recognize a lot of people are staying home. They're avoiding crowds. They are helping us get through this in the best way possible. And to all of you, thank you. We need you, and we appreciate the sacrifices that each of you is making. A lot has happened over the last few weeks, and we know that more will happen, but we are taking all of this one step at a time. We are being thoughtful. We are being guided by data and information, by experts and science, and we are working very hard to stay ahead of this virus, to prevent us from getting to where the difficult, very difficult positions where other communities have ended up already. We have been in touch with several healthcare professionals. For example, Dr. Burwinkle with the School of Public Health at the University of Texas, who informed us very alarmingly yesterday, we must take steps. Now, any delay in additional action would be incredibly problematic. The models he has produced require us and truly exhort us to take additional aggressive steps. The frontline entities who are fighting this disease are hospitals. The CEOs of each of the hospitals at the Texas Medical Center, as you all know, the largest medical center in the world, come together every day to discuss coronavirus. They've never been more united than they are today. And I speak with the CEO of the medical center, Bill McKeon, almost on a daily basis. They are seeing the rate of patients coming into their hospitals, and they have also sounded the alarm. So you'll hear in a little bit from Dr. Boom with Methodist Hospital, and he will share, as he shared with me, an exponential increase that he has seen in the number of patients coming into the hospital, the percentage of those who need to be treated in the ICU, and the length of time that patients have to spend in intensive care. We're seeing that patients here are having to spend longer in intensive care than in other places. What these experts, leaders, and folks in the front lines tell us is that if we keep going at the rate we are going, we will end up in the situation that New York is heading towards, that Italy is at, where we simply run out of ICU space regardless of the surge capacity that each of them and all of us are helping to build, that we simply would have to get there. And so that is why it's incumbent on us to take additional steps above and beyond those we've already taken. We've been working very, very closely with researchers, with businesses, with local elected officials from throughout the region. But the most important factors are science and health. We are letting science, data, and health drive the decisions we make. Our North Star is the best data we have and what our medical community is telling us to do. So after consulting with these folks, we're taking today another step to prevent the spread of coronavirus. When we put out the bar and restaurant order with Mayor Turner a few days ago, we said that if we erred, we would err on the side of action. And in that spirit, we are taking steps to prioritize human life. And so I'm issuing a stay home, work safe order for Harris County, walking in lockstep with Mayor Turner and proud of the partnership that we have across our region. This order will apply throughout Harris County, including unincorporated areas and all the cities within Harris County. To put simply, this means that all of us should stay home unless our jobs are essential for the health and safety of our community. Those of us whose jobs are essential to health and safety must do everything we can to maintain 6 feet from one another and keep ourselves safe. So that's what we mean. Stay home unless your work is essential. And if your work is essential, you must work safely. Hence, stay home, work safe. We are following a simple model. By staying home, we are saving lives, we are flattening the curve of the virus, and we're making sure that we're not overwhelming our healthcare system and therefore our community as a whole. No one, including myself, wants to be in a position to sign that kind of an order. I know that it will cause hardship, more financial pain, that it will be difficult on top of what we're already facing. But on balance, we recognize that the minute we end up in a decision where we're having to turn people away from a respirator, from an ICU bed, and choosing who lives and dies, that we don't want to be in that position, that would be catastrophic. And the models we have show us getting to that position where we far exceed the number of ICU beds in this county unless we take drastic steps. To be honest, it was not a hard decision based on the data, because if we follow this, we will save lives. The order will be effective tonight at midnight and will go until April 3rd, which is as long as the governor's order is in effect to make sure that we are consistent with the state. We will, of course, revisit the order as necessary. Now, to go over what the order entails. There is a list of 16 sectors that is put out by the federal government called the Cybersecurity and Infrastructure Security Agency Guidelines, CISA Guidelines. The federal government notes what the 16 sectors are that are essential, and the idea is to maintain the supply chain of these essential sectors across localities and across the country. And so that list includes things like energy, healthcare, transportation, critical manufacturing, and others. The order will have a retooling exception for factories, for example, who can turn to making hand sanitizer, N95 face masks, respirators. Beyond that, in terms of gatherings, all public or private gatherings outside of a single household or living unit will be prohibited, except for essential activities by members of the community. And that includes, of course, tasks essential to health and safety, so medical professionals needing to get necessary supplies, food, pet food, household consumer products. Engaging in outdoor activities so long as there is social distancing. And so we are going to start by allowing parks to remain open. No playgrounds, no exercise equipment, no benches, nothing that can be touched, because we know the virus can live on surfaces for up to 48 hours. Folks who do leave for outdoor spaces must maintain social distancing of 6 feet from any person, and we'll see how we do with that. Folks can leave their home to care for a family member or a pet in another household. So that's the context of essential. Obviously, all businesses, except for essential ones, will be required to cease all activities. Essential businesses must comply with the 6-foot social distancing requirement to the best extent possible. Restaurants remain at takeout, delivery, drive-through, but they must space customers out at 6 feet from each other. Daycares that provide support for essential employees will be open. If someone in a household has tested positive for COVID, the household will be ordered to isolate. Members of the household will not be able to go to work. Religious and worship services only via video or teleconference. We will be making an exception for faith leaders to be able to minister one-on-one for mental health purposes, for spiritual health purposes, as long as social distancing is being implemented. This is incredibly complex. It is messy. We've been working round the clock for several days to get this right. You can't flip the switch and turn the lights off on a county of 5 million people, and that is not what this is. The attorneys are still working. We're working to apply lessons learned from orders elsewhere to make sure we're not contradicting anything. We hope and trust people will comply, but we will be ready to enforce this order. A brief note, not enough is being said about physical, mental, and emotional health, and so I do want to point out, the exception we are making for faith leaders to be able to minister one-on-one. On harrishealth.org, folks can see a link to our mental health hotline. Of course, that's the thinking behind keeping the parks open, and we'll be watching and hoping that folks will employ social distancing. So again, no playgrounds, no basketball courts, right? We don't want people close together. And we'll continue thinking about how else we can support our community. Finally, an update on county testing. We started countywide community testing yesterday. We referred about 500 people total to the sites. That is 100% of our testing capacity for the 2 sites that we open. Yesterday, we had almost 24,000 residents visit our online screening tool, and we are continuing to integrate with the city site so that we can all go through that and work in lockstep. The only caveat there to be aware of, as I've been mentioning for the past 10 days or so, we are relying on federal government supplies to keep these testing sites open. So they sent us a shipment, I believe last Friday. That's the one we're being able to use. We had the pilot this weekend. We opened yesterday, and that shipment will last us certainly through today. If we don't receive the additional shipment we are expecting from the federal government, we will have to stop our county testing for the most part again and wait until that shipment arrives. And so that is the challenge we have, but we are ready to continue 100% as we did yesterday, and we're in direct contact with our federal partners and trust and hope that that shipment will arrive. So let me stop there. I will briefly repeat remarks in Spanish, and then I'll invite Mayor Turner and the doctors to speak. En español, brevemente, quiero agradecerle a todos los miembros de la comunidad que han sido parte de la respuesta, de la protección de todos hasta ahora. Sé que muchos están quedándose en casa, nos están ayudando a no estar cerca los unos de los otros para prevenir el contagio de este virus. Entonces quiero reconocer los sacrificios, agradecerle a todos ustedes que nos están ayudando. Hemos visto información en los últimos días acerca de a dónde va esto en nuestra comunidad. Un profesor de la Escuela de Salud Pública de la Universidad de Texas nos ha dicho que es el momento de actuar ya mismo. Si no lo hacemos, vamos a estar en un punto donde se verán los hospitales con demasiados pacientes y tendremos que decidir quién vive y quién muere. También estamos en contacto con los líderes de cada hospital en el centro médico. Como saben, tenemos aquí en el condado Harris, en Houston, el centro médico más grande del mundo. Y los líderes de cada hospital están trabajando juntos y todos ellos están de acuerdo con que este es el momento de tomar acción drástica. Ellos ven en sus hospitales un crecimiento exponencial en el número de pacientes que están llegando con síntomas del virus, el porcentaje de esos pacientes que necesitan ir a cuidados intensivos y la cantidad de tiempo que los pacientes están permaneciendo en cuidados intensivos. Si continuamos con esa tasa de crecimiento, muy pronto no tendremos más camas para los pacientes y podría colapsar nuestro sistema de salud. Entonces, estamos en hora de poder detener esta tasa de crecimiento, de poder cambiar la dirección a donde vamos y prevenir el que terminemos como Nueva York, que se ve muy cerca al límite, como Italia y otros sitios. Entonces, este es el momento de actuar. Hemos hablado con líderes de bastantes negocios e industrias, hemos hablado con líderes políticos alrededor de la región, pero lo más importante es la ciencia y la salud. Estamos permitiendo que tanto la ciencia, la salud, la información, la investigación guíen nuestras decisiones. Y realmente nuestra guía número uno es la información que tenemos, los números que hay y la información, las recomendaciones que los profesionales médicos nos están dando, todos estos líderes de los hospitales a través de la comunidad. Entonces, hoy estamos tomando un paso más. Yo dije cuando tomamos la orden, cuando implementamos la orden de los restaurantes y bares, que si cometemos un error, será por acción. Estamos tomando pasos, tomando acción para proteger a la comunidad y no queremos no actuar. Preferible actuar de más y salvar vidas. Entonces, basado en eso, basado en toda la información que nos han dado los médicos y los expertos, hoy estoy ordenando una orden de quédese en casa, trabaje seguro. ¿Qué significa la orden? Primero, quédese en casa. Todos nosotros debemos quedarnos en casa a menos de que nuestro trabajo sea esencial para la salud y seguridad de esta comunidad. Aquellos de nosotros cuyo trabajo es esencial, debemos hacer todo lo posible por trabajar a 6 pies de nuestros colegas de trabajo. Realmente no quiero estar en esta posición, sé que va a causar muchos retos financieros para muchas personas, sé que ya está esto causando muchos retos, sé que es difícil. Pero esto nos va a ayudar a salvar vidas, a prevenir que tanto el sistema de salud como la comunidad en sí no colapse. Entonces, necesitamos tomar esta acción hoy día. En cuanto a qué significa exactamente la orden empezará a medianoche el día de hoy, irá hasta el 3 de abril, que es cuando la orden del gobernador Abbott expirará y obviamente vamos a evaluar esta orden como sea necesario. Hay 16 sectores que el gobierno federal dice son esenciales. Tienen una lista se llama CISA, C-I-S-A, donde ponen los 16 sectores que son esenciales. Y esos sectores incluyen energía, cuidado médico, transporte y fabricación esencial y otras más. Entonces, esta orden va a proteger aquellas industrias para poder mantener toda la cadena de producción en esos sectores esenciales. Habrá una excepción de reorganización si hay una fábrica que puede ahora producir, por ejemplo, las máscaras, producir materiales necesarios para protegernos del virus, entonces esa fábrica podrá continuar trabajando. Fuera de eso, todas las reuniones públicas o privadas, fuera de una casa, de una unidad en una casa, apartamento, sitio de vivienda o fuera de eso, serán prohibidas. Ahora, permitiremos actividades esenciales. Eso es, por ejemplo, si usted es profesional médico, debe salir. Si tiene que ir a comprar materiales necesarios, comida para las mascotas, materia necesaria para su casa. Puede participar en actividades afuera. Entonces los parques permanecerán abiertos siempre y cuando se cierren cualquier superficie, nada de canchas de basquetbol, sillas, material de ejercicio para los niños, nada de eso, porque sabemos que el virus vive en las superficies hasta 48 horas. Estaremos observando hasta qué punto la comunidad nos ayuda al estar afuera, mantener esa distancia de 6 pies. No podemos tener grupos de gente. Cada persona debe tener un espacio de 6 pies, si están afuera, si están en el parque. Podrá también salir para cuidar a un miembro de su familia o a una mascota en otro hogar. Obviamente todos los negocios que no sean esenciales tienen que detener sus actividades. Aquellos negocios que sí son esenciales deben obedecer el requerimiento de dejar 6 pies entre personas hasta donde máximo sea posible. Los restaurantes todavía podrán ofrecer servicios como lo están haciendo de drive-thru, de poder recoger la comida, pero tienen que asegurarse que los clientes estén a 6 pies los unos de los otros. Las guarderías que ofrezcan servicios a empleados esenciales, empleados en esos sectores esenciales, podrán permanecer abiertas. Si una persona en un hogar es positiva, tiene el virus, ese hogar, cualquier miembro del hogar, tienen que permanecer en casa, no pueden ir a trabajar. Los servicios religiosos deben llevarse a cabo a través de video, teleconferencia. Tendremos una excepción para pastores, para ministros que puedan atender a miembros de la comunidad uno a uno. Entonces, manteniendo esos 6 pies y visitando personas individuales para poder proteger la espiritualidad, la salud mental de las personas. Esta orden va a aplicar a través del condado Harris en las áreas tanto fuera de las ciudades como dentro de todas las ciudades en el condado Harris. Es una orden compleja, es una situación un poco complicada, pero hemos trabajado por días para poder crear una orden que realmente aprenda y mejore las órdenes que han habido en otros sitios. Asegurarnos que no hayan contradicciones hasta donde podemos, que sea claro. No podemos apagar la luz en un condado de 5 millones de personas y eso no es lo que estamos haciendo, no es lo que queremos hacer. Pero sí tenemos que asegurarnos que las personas estén en casa y que no haya más contaminación de este virus. Espero y realmente creo que la comunidad participará, pero estamos preparados para asegurarnos que todos miembros de la comunidad obedezcan esta orden. 2 notas para terminar. Primero, en la salud mental. Es muy importante, muchos de nosotros nos sentimos aislados, sabemos que esto es un reto para la salud mental, por eso estamos permitiendo que los ministros puedan trabajar uno a uno con personas. Hay una línea de llamadas a través de readyharris.org donde puede también accesar una línea de salud mental. Por eso también estamos dejando los parques abiertos, pero necesitamos que nos ayuden a no haber contacto de más de 6 pies y seguiremos trabajando para apoyar la salud mental de la comunidad a través de este reto tan grande. Finalmente, en cuanto a las pruebas, ayer abrimos 2 sedes de pruebas en el condado. Pudimos llevar a cabo alrededor de 500 pruebas. Eso es el número máximo que teníamos. Recibimos 24,000 visitas a nuestro sitio web. Es necesario, estamos a capacidad máxima, planeamos seguir trabajando con la ciudad. Nuevamente, las pruebas están en readyharris.org. El reto, como he dicho ya varios días, es que los materiales para las pruebas vienen del gobierno federal. No hay materiales de cantidad, de volumen tan grande. Aquí localmente no hemos logrado conseguir adicionales. Entonces estamos totalmente dependiendo del gobierno federal. Nos enviaron el viernes el primer envío de materiales, hicimos el piloto el fin de semana, se abrió ayer y todo salió muy bien. Estamos esperando otro envío el día de hoy. Podremos llevar a cabo hoy otra vez otras 500 pruebas a través del condado, más a través de la ciudad. Todo pueden visitar en readyharris.org, pero si no recibimos el envío del gobierno federal, vamos a tener que detener las pruebas nuevamente. Entonces quiero que sepan ese reto que existe, confiamos, esperamos que el gobierno federal nos va a enviar las pruebas. Entonces, voy a dejarlo ahí, va a hablar el alcalde y después tendremos los dos doctores, el doctor que también es el líder del hospital Methodist en el centro médico y también el líder de nuestro sistema de salud en el condado Harris. Entonces, thank you so much, Mayor Turner, thank you for your partnership.
Let me start off by thanking Judge Hidalgo for her leadership and for the order that has been put forth this morning. Let me say we've had the opportunity to work with the judge, and even on yesterday on a conference call that was convened by the judge where there were over 50 other individuals in our surrounding region, other mayors, other county judges, in which we discussed the order that is being put forth today. And I can say to you without reservation that the judge and I are standing together. We both recognize that these are very challenging times. In fact, let me go one step further. We are in a healthcare crisis. And in order not to prolong this crisis, in order to blunt the progression of this virus, we both recognize that steps need to be taken in order to slow the progression, to blunt it, so that we are not in this situation longer than we need to be. In the region, in our region right now, even beyond Harris County, there are about 160 confirmed cases. The steps that are being taken this morning is the hope of that we don't have 1,600 cases in our region, or the number just doesn't continually go up and up and up and up. In the city of Houston, we have 24 cases. Doesn't mean that there are only 24. There are more than 24. We all know that. But the goal that we are taking is so in the city of Houston, we don't have 2,400 cases or 24,000 cases. And the best time to take the steps that are being put forth, the best time is right now. We don't have the luxury of waiting 2 weeks down the road and then deciding that this is the time to take these steps. Will it impose an additional inconvenience on many of the people in our region? Yes. Are those inconveniences worth it? Yes. Do we have a choice based on the health care advice and that we are given? No. Did we come to this point easily? No. But is it important for people within our respective regions, for people in Houston and Harris County and even beyond, to recognize that this situation is serious and to recognize that if we don't act and act now, then the situation will only get worse. And we keep talking about flatten the curve, but it's important that we do that through our actions and through our behavior. In our region, we have faced major storms, we have faced mass shootings, we have faced chemical releases, and in those times, we have asked people to shelter in place. And that terminology, shelter in place, should be reserved for shootings, explosions, major storm events, rain events like Harvey, when we ask people to shelter in place. This is another type of crisis, another type of situation that requires strategies that you are uniquely adopted in order to address it. And therefore, what is being presented in the order that the county judge is putting forth is a stay home, work safe order. Let me say the stay home, work safe order is a more strategic way to blunt the progression of COVID-19 and balance the needs of families, businesses, and the city's economic interests. The new order means people must stay at home, except when they need to conduct essential businesses and activities. But the requirement for social distancing remains in effect, whether you're at work or whether you are away from work. The requirement for social distancing remains in effect. You must stay 6 feet away from others. If you work in a critical infrastructure industry, you have a special responsibility to maintain your normal work schedule, which is in the best interest of the community. The Stay Home, Work Safe order exempts essential workers covered in the 16 CISA categories, the Cybersecurity and Infrastructure Agency. They are the people who work in transportation and logistics to maintain our safe drinking water, communications and technology, and commercial and residential construction, and many more. Houston is the energy capital of the world. We have the largest medical center in the world and the #1 port in terms of foreign tonnage, and we are proud of that. Those critical workers and others will be allowed to continue moving back and forth through the community because we must balance our health care concerns with economic realities. But even though in those particular essential industries, they are being allowed to continue to work, while they are at work, they must be safe and must employ as best as possible the social distancing and other requirements, and we expect them to do that. For others, Stay Home, Work Safe means employers are encouraged to let their team work remotely from home where possible. People working from home do not have to shelter in place or feel as though that they can't move around. You still can go to the grocery stores, to the pharmacist, to the gas station to medical treatment, seek medical treatment. And I want to be very clear on this because we've said over and over again that the grocery stores would not shut down. And they are not shutting down. Even with this order, the grocery stores remain open. The food supply chain remains sound. Okay? It remains sound. But even as you go to the grocery store or to the pharmacist, you still must engage in social distancing because that still becomes very important. Otherwise, we are defeating the very purpose that we are trying to achieve. Residents can also go outside to run, walk, and exercise if they practice social distancing and stay at least 6 feet away from other individuals. Now, Judge Hidalgo indicated that we are keeping the parks open, and we recognize that people are just not going to, in a sense, stay right there in their homes, that they need to walk outside in their communities, in their neighborhoods, and will go to the parks. But let me put a cautionary note here. That does not mean that you can flood the parks and crowd the parks and not engage in social distancing. If you go to the parks, then you need to be responsible. You need to continue to maintain the social distancing. And if you do not do that, then again, we are working against each other's interests. We are both trying, all of us are trying to be flexible and recognize the social dynamics and the human dynamics, but you still must exercise individual responsibility. Over the last several days, we have asked residents to comply with new restrictions, from shutting down bars and nightclubs and allowing restaurants to serve only takeout and delivery. But the message is clear. You must stay at home to help blunt this progression of COVID-19. And the best way to reduce the spread of the coronavirus and stop the pandemic is through strict social distancing. As we do more testing, we're getting more evidence of community spread. We know for every new positive result, there are more people we do not know about who may have the virus. And we do expect the numbers to rise. That is not new, but we can blunt its progression. If we work together, we can get on top of COVID-19, and the sooner we can stop the progression, the sooner we can all return to our normal way of life. As Judge Hidalgo mentioned, the order will begin tonight at 11:59 p.m. and end on April 3rd. And I will ask members of City Council and others to join with us in explaining and articulating the message to all of the people within the city of Houston. We are in this together, and we must work together to protect public health and safety. And let me just say in closing, my destiny is in your hands, and your destiny is in my hands. And where we go from here, in large part, will depend on how we now change our behavior to recognize the crisis that we are in. And it is serious, and we have to take it serious. But one thing that I know about Houston, Harris County, and our surrounding region, that when people are given the truth, and when we're asked to do something, we get it done. And this is one time when we're asking people within our respective regions to stand together, to operate responsibly, and let's blunt the progression of this virus. And let's do it now without having to look back 2 weeks from now or a month from now and regret that we did not take the necessary action when we could have. We're in this together. We'll come out of it together. And in the end, this area and this region will continue to grow and prosper. The best days for all of us, still yet to come. Judge.
Thank you so much, Mayor Turner. We'll hear from Dr. Mark Bloom, CEO of Methodist Hospital, as well as here on behalf of the Texas Medical Center CEOs. Dr. Bloom.
Thank you, and I want to start by thanking Judge Hidalgo and Mayor Turner for making the right call. I'm here as a representative of the entire Texas Medical Center. As was mentioned, all of the CEOs of the Texas Medical Center, we start our day with a 7 a.m. call each day. There's 11 of us on the call, and we are unanimous in our support of moving forward with this order. Let me explain a little how we come to that decision as a medical community. We don't come to that decision lightly. We recognize that it requires a great deal of sacrifice and that everybody really has to work together to do this. We come to that decision based on data, and we come to that decision based on science. We have looked at modeling, which Judge Hidalgo has alluded to, that says the time to act is now. We have heard from the modelers in town that says the time to act is now. Every piece of data we see coming in from our institutions says that the time to act is now. Every piece of data and advice as we look around the world is that communities who do well because they act briskly, promptly, and decisively to help push this down. Once this gets out of control, it is extremely difficult to control and bring back down. So we are all unified in our approach and really very grateful that this will happen. This is all because of the nature of the virus, which spreads to 2 to 3 people from each infected person, which is a pretty large number in the book of viruses, so to speak. In other words, what happens mathematically is as you infect 2 or 3 people and they infect 2 or 3 people and they infect 2 or 3 people, the mathematics of that shoots up dramatically. And when that shoots up dramatically, that's when things get out of control. If you look at China, if you look at northern Italy, if you look at what's emerging in New York City, much to our alarm right now, those are communities where this has gotten past the ability or is approaching past the ability of the medical community to respond. And that's exactly what we are trying to avoid in the city of Houston. Across the Texas Medical Center I just described, you were talking about 70% or so of the adult inpatient capacity and probably pushing 90+% of the pediatric capacity across the city. So you have alignment really of a great critical mass of leadership across the city. Every one of our hospital systems is working diligently to do all of the things that we need to do to be ready in a situation like this. First and foremost, we all stopped doing our elective procedures and many other procedures to really start emptying out capacity within the institutions. We're focusing on all the supplies, the equipment, the ventilators, and everything else that we need in place. And we're focusing on what I term surge-in-place capacity, which is the ability to expand what we're able to do within our 4 walls.